Today, we are diving into the absolutely wild history of something that's incredibly common, but for centuries was incredibly condemned. This is a story about how we went from medical terror to modern understanding, and believe me, it says a whole lot about our relationship with science, shame, and our own bodies.
So to really get a handle on just how far we've come, let's start here. Not with what we know now, but with this terrifying medical warning from the 1700s. I mean, listen to those words: deplorable, incurable. And this wasn't some fringe opinion, okay? This was the mainstream medical belief that kicked off 2 full centuries of fear.
All right, so here's our roadmap for this explainer. We're going to start with that history of fear, then trace the scientific awakening that tore it all down. After that, we'll look at what modern medicine actually says, explore the cultural hangover, and finally land on the modern view.
Okay, so our story really gets going in the 18th century. You've got this wave of, well, moral and medical anxiety that just sweeps across Europe, and it manages to turn a totally private act into this huge public panic.
And this panic even got its own name, onanism. The term was pushed into the mainstream by this hugely popular pamphlet from around 1716 called Onania. And the genius of it, if you can call it that, was that it wasn't just a religious sermon. Oh no, it was framed as a medical warning, promising all sorts of frightful consequences. It basically turned a Bible story into a medical diagnosis that spread like wildfire. So then, this moral panic gets a doctor's lab coat. A very prominent Swiss physician, Samuel Auguste Tissot, publishes this big medical treatise. Now, it was all just pure guesswork, but it was presented as this scholarly, scientific work. And you have to remember, this was a time before rigorous experiments, so his authority was taken as gospel all across the Western world.
By the time we get to the 19th century, things had completely spiraled out of control. You had influential doctors actually claiming that masturbation was a direct cause of insanity. And this led to this, absolute chamber of horrors of so-called cures. We're talking everything from scary restraining devices and electric shocks to, in the most extreme cases, literal surgical removal of genitals. It's truly horrifying to think about. So, the big question is, how did this massive medical myth, this great terror, finally come crashing down? Well, for that, we have to jump into the 20th century and see how hard data and actual observation started to replace pure dogma. And the reversal in thinking was, well, absolute. The really crucial shift was moving from just assuming something caused a problem to actually demanding evidence. After decades of proper research, scientists found zero, and I mean zero, causal link between the act and any of the horrible diseases it had been blamed for. The emperor, it turned out, had no clothes.
A giant figure in this whole turnaround was the sexologist Alfred Kinsey. His research in the 1950s was a total bombshell. When his data came out showing that 92% of men had masturbated, well, you just couldn't frame it as some rare, deviant behavior anymore. It was so obviously a completely normal part of being human.
Now, this change didn't happen overnight. It was this slow, gradual process. It started with people like Freud thinking about it differently. Then it got a massive push from Kinsey's data. And it was finally set in stone when the big medical organizations, like the American Psychiatric Association and the American Medical Association, officially took it off the list of disorders. Science was finally catching up to reality.
All right, so now that all those old myths have been totally debunked, let's take a look at what science has actually discovered about the real health effects.
And the modern picture is, well, overwhelmingly positive. A whole bunch of studies have pointed to some real benefits. For guys, some research links frequent ejaculation to a lower risk of prostate cancer. And for everyone, it's a known stress reliever, a great sleep aid, a fantastic way to understand your own body. And of course, it's a form of safer sex with pretty much zero risk of transmitting infections.
So what about the risks? Well, here's the thing you really need to get. The risks are almost never about the act itself. They're almost always about how it's done. Like using things that can cause injury or being way too aggressive. The only other real concern is when the behavior becomes compulsive. And even then, that's seen as a symptom of a deeper issue, not a problem caused by the act itself.
But here's the catch. Even with this crystal clear medical consensus, those 2 centuries of fear left a really deep mark. That historical stigma hasn't just disappeared. You can still see its echoes in our culture, our laws, and, yeah, even in our own personal feelings. And this slide just perfectly illustrates that disconnect between science and culture. A study from 1994, and remember, this is long after the medical world said everything was fine, found that about half of adults who masturbate still felt guilty about it. It just goes to show you how powerful cultural taboos are and how long they take to fade.
You can actually watch this tension play out in pop culture. In 1972, a novel that even mentions it gets banned. Just a decade later, you have Monty Python making fun of the whole thing, and then, by 1992, you get the contest episode of Seinfeld, one of the most famous episodes of TV ever, which is all about masturbation without ever saying the word. So it went from unspeakable to being satirized to becoming a primetime punchline.
Legally speaking, the modern world is pretty clear and consistent on this. There's a really hard line drawn between what you do in private and what you do in public. In private, it's considered a personal right. In public, it falls under public indecency laws. Simple as that.
So, after this completely wild journey, where does that leave us? Let's jump into our final section here and pull everything together to really understand the definitive modern perspective. Honestly, I don't think anyone has ever summed up this dramatic flip-flop better than the psychiatrist Thomas Szasz did way back in 1973, from a disease to a cure. I mean, that one quote just perfectly captures the entire 100-year revolution in thinking that we've just been talking about. So, if there's one key takeaway from this whole explainer, it's this. The professional consensus today is absolutely clear. It is considered a healthy, normal, and frankly an important part of sexual development and well-being, all the way from childhood through old age. The science is settled.
And that just leaves us with a final question to chew on. This journey, from a private sin, basically invented by pamphlets, to a disease defined by pure guesswork, and finally, to a normal behavior confirmed by data, is just an incredible story. It really makes you ask, what does this whole saga tell us about how science, culture, and fear can shape the most fundamental relationship any of us will ever have, the one we have with ourselves?